Hello friends, I am Dr. Rohini Ruhil. Today we will study the effects of climate change on child health. This particular video is focused on child health in the context of low and middle income countries. Now climate change represents one of the most significant global health threats of current times. And this has already been discussed in a previous video which was in general about the climate change. Regarding this particular video, the impact of climate change on child health is particularly concerning due to unique vulnerabilities of children. Now, why children are so vulnerable? What are those unique vulnerabilities? Let us study in detail. Now, children possess vulnerabilities due to their physiological, developmental, and dependency characteristics. Now, what are these characteristics? Like physiological characteristics, children have a higher surface area to body mass ratio comparing to adults. Their body mass is less, and as compared to body mass, their surface area is more, which makes them more susceptible to heat and cold stress. Then their respiratory systems are still developing. They uh, uh, they breathe more air per kg as compared to their body weight. So this increases their exposure to pollution and airborne allergens. And that's why we can see asthma in small children, and nowadays the morbidity due to asthma in children is increasing year by year. Then developmental vulnerabilities are also there. Lead and other pollutants. These can have detrimental effects on children's cognitive development and development of, overall also. Then nutritional deficits, because climate poses agricultural insecurity, food insecurity, and this can lead to malnutrition in children, which affect their growth and development. Then we have dependency vulnerabilities, like children depend on adults for their health care, and this health care may be compromised during climate events. So these are some children specific vulnerabilities. Now, what are the pathways through which climate change affect child health? There are some direct pathways and there are some indirect pathways through which the climate change affect child health. First, as discussed previously, children are more susceptible to heat stress, heat related illness due to their developing thermoregulatory system. Second, climate change increases the frequency of natural disasters like hurricanes, uh, um, snowstorms, floods. These are more frequent these days, and they pose immediate physical danger to children. There are direct effects related to this. Then, third, events like flooding. Flooding leads to waterborne diseases like cholera, typhoid, dysentery, and it becomes very difficult uh, to manage such cases in children during flooding. Then climate change affects agricultural productivity as discussed previously, leading to food insecurity, malnutrition. Now, one more thing is there that climate change is altering the precipitation patterns. Now we have more such days where mosquitoes can breed. So the result is higher morbidity due to vector-borne diseases, especially in children. So these are some of the direct and indirect pathways through which climate change affect children. Now, children in low and middle income countries, LMICs, are particularly vulnerable. They face significantly higher risk from impact of climate change as compared to developed countries. Now, this increased vulnerability in LMICs is due to several factors. Why? Like, first is they have limited resources, then they have a weak healthcare system. The population in such countries do not have access to healthcare, so they already do not have access to healthcare. They already do not have safe drinking water, sanitation facilities. They do not have resources to cope up with the effects of the climate change. So on this deprivation environment, it becomes very difficult for LMICs to deal with the climate related consequences. And then there is a greater reliance of LMICs on climate sensitive sectors, like greater reliance on agriculture. So that affect their health, food insecurity. Now poverty, lack of education, limited access to healthcare. So these are the critical factors that influence the degree of vulnerability, which makes LMICs more vulnerable to effects of climate change, and especially children in LMICs. Now, UNICEF came out with this landmark report in 2021. It introduced Children's Climate Risk Index. So, let us look what was Children's Climate Risk Index. The Children Climate Risk Index (CCRI) is structured according to two central pillars. There is pillar 1, where is exposure to climate and environmental hazards like shock stresses. This is seen, the exposure is seen, and second is where child vulnerability is seen. Okay, so now across these two categories, exposure and the vulnerability, the CCRI brings 57 variables together to measure the risk. And this they measured this risk across several countries in the world. Now this table shows the ranking of countries where children are most at risk. Here you can see that African countries are ranked higher, and India is ranked 26, where the score for exposure to climate hazard is 9 out of 10, and the total score of India for children's climate risk index is 7.4 out of 10. So this is a matter of concern for the country itself. Then several international bodies of healthcare practitioners have also shown concern regarding this topic. For example, Royal College of Pediatrics and Child Health, they have given their position statement on the impact of climate change on child health globally, and they emphasize that child health should be central to the climate policy decisions, and they recommended rapid transition away from fossil fuels. Even in COP28, the discussions were around that we are now saying goodbye to fossil fuels. We are in the process of transitioning away from fossil fuels. Now, how much it materializes on the ground, that we have to see in the coming days. So, as a way forward, we need to focus on cross sectoral collaboration, sustainable technologies, and we should adopt a child focused approach in all our climate discussions. So, child focused approach is very important. And with this, I end my presentation. Kindly like the video and subscribe to the channel. Thanks for watching. Bye bye. See you in the next video.